Monday at 7:12 a.m., Dr. Malcolm Weiss found an unmarked padded envelope outside his townhouse door. Inside lay a cheap USB stick, no note, no return address. He was accustomed to odd tokens from grateful or disgruntled patients, drawings, letters, once a ceramic bird. But the courier of this item stayed invisible. He slipped it into his jacket thinking it probably contained malware, yet curiosity stalked him as he drove to Briarwood Veterans Hospital. By the time he reached the parking lot, he'd resolved to plug it into the air-gapped dictation laptop in his office. 2 minutes, he promised himself, then coffee, then patience. The stick held a single folder stamped with that morning's date and his initials. Inside, an MP3 titled 9H0 McHenry. His first appointment was indeed Lieutenant Carl McHenry, an infantryman wrestling with moral injury. Weiss clicked play. For half a minute, he assumed he was hearing a recording of a previous session, his measured baritone asking Carl about nightmares, Carl's clipped replies. Then Carl described a new dream. An IED in a crowded bazaar, children screaming, imagery the lieutenant had never mentioned. Weiss froze. The appointment was still 50 minutes off, yet the file depicted it as fait accompli. He listened through dazed disbelief. The recording covered the entire 50-minute hour, ending with his own voice delivering a standard valediction. Same time next week, Lieutenant. A muffled click followed, then a rasping whisper, as though someone had leaned into the mic. You will decide not to chart this dream, Malcolm. You'll convince yourself it's incidental. He won't return. In 3 months, he'll eat a bullet. Good work, Doctor. Weiss ripped off the headphones, heart drumming. The computer clock read 8:14. He had 46 minutes to disprove the prophecy. At 9 o'clock, Lieutenant McHenry sat across from him, angular and exhausted but polite. Weiss pushed away the paranoiac echo and opened with practiced neutrality. 10 minutes in, Carl reported the identical bizarre dream, syllable for syllable. Weiss forced his fingers to remain steady on the keyboard. He asked follow-up questions that weren't in the file: casualties, smells, survivor guilt, hoping to bend the script. Yet each addition nudged Carl deeper into despair, aligning perfectly with the audio's cadences. At the session's end, Weiss tasted metal on his tongue. Same time next week, he croaked. Carl gave an uncertain nod. After the door shut, Weiss wrote a meticulous note, twice his usual length, flagged the case for trauma fingerstick exposure, and emailed McHenry a grounding worksheet. Triumph briefly flickered. He'd charted the dream. He'd cared diligently. The whisper's taunt was void. 2 hours later, an email arrived from reception. Lieutenant McHenry wished to cancel all future appointments, effective immediately, no reason. Weiss stared until the letters smeared, then unlocked his drawer and retrieved the USB with trembling fingers. That evening, he poured scotch and inspected the drive again. Beside the McHenry folder sat another, stamped with tomorrow's date, 10H30, Dashkins. Glinda Haskins, middle-aged nurse, compulsive hoarder. The audio depicted a suffocating session, Glinda sobbing as he urged her to discard family memorabilia. She stormed out. 2 weeks later, her husband filed for separation. The whisper returned. Your impatience will teach her that anxiety is safer than your pity. She'll pack the empty rooms with garbage bags until the floor collapses. Clap for yourself, Malcolm. He gulped the drink, stopped the file, considered a second glass, drank it. Sleep came in jagged splinters. He dreamed of blinking play buttons chasing him down fluorescent corridors. At dawn, he drafted an alternative plan. Gentle, motivational interviewing. No pressure to discard. In the office, however, a sealed envelope lay on his keyboard. Inside, a CD labeled Revision. It contained another Glinda recording, identical to the first except where he intended kindness, his recorded voice dripped sarcasm and contempt. His palms glistened with sweat. Glinda arrived early, plastic tote clutched like a life vest. Weiss executed his careful script, yet her responses matched the brutal CD. As though she heard derision anyway, she left crushed. He canceled his afternoon and called IT. They found no malware. He phoned the police, who referred him to hospital security. Forms were filed. Nobody sounded persuaded. The USB locked in its drawer seemed to hum. Day 3's folder promised horror with 8-year-old Jason Price, whose selective mutism had been thawing slowly. The audio predicted a catastrophic breakthrough. Jason would speak only once, shriek, "Liar!" and bolt into traffic after school pickup. Weiss refused to listen. He left the stick at home, projected serenity in clinic. 40 minutes in, Jason's eyes widened. He whispered "liar," bolted under his mother's chair, and progress crumbled. Weiss shut himself in the restroom and vomited. Patterns deepened. An envelope at dawn, an audio prophecy. His futile detours. Precise fulfillment. The whispers grew playful, offering snide clinical advice. Friday's file merely hummed a lullaby, as though his failures had become self-sustaining. He considered taking leave, but a recording predicted administrative leave morphing into suspension. Smashing his electronics, another file warned of arrest for property damage. He felt trapped inside someone else's outline. Dr. Nadia Sorensen, department chair and friend, was his last refuge. He invited her to dinner, resolved to reveal everything. Before leaving, he forced himself to hear the nightly file. It contained their entire conversation. He heard his own stammer, Nadia's sympathetic yet clinical questions, her recommendation for psychiatric evaluation. Then the recording veered. He grew agitated, accused her of conspiracy, hurled a wine glass. The whisper, "This will be your professional suicide note." Reawas shuddered. Could he possibly improvise such catastrophe? He went anyway, determined to stay calm. For half an hour he succeeded, disclosing the files, handing her the USB. Nadia listened gravely, spoke of forensic experts. Relief fluttered in him. Then the waiter arrived with an unlabeled Barolo he had not ordered. Nadia teased him for extravagance. The cork popped. Dark wine splashed the white linen, staining her blouse. Weiss rose to help, bumped the table. A glass toppled, shards flew, slicing Nadia's palm. Diners gasped. The restaurant asked them to leave. Outside, wind-slapping coats, Nadia's voice trembled. "Malcolm, take tomorrow off, please." Prophecy fulfilled, again. That night he locked doors, unplugged electronics, buried the USB in the freezer, swallowed 2 lorazepam. At 3:17 a.m. the rotary phone rang. He lifted the receiver to static, then his own older voice. "The freezer won't stop time, doctor. Listen." New track unfurled, detailing his upcoming psychiatric evaluation, the botched impressions, the board suspension, the void where patients used to be. Morning delivered the verdict. An HR email fitness for Dowdy assessment Monday. Scalding shower water couldn't thaw the dread. He saw only 2 options: battle the tapes or submit and learn. He dug the USB from ICPs, set up his old handheld recorder, and spoke. "Whoever you are, you win, but tell me why." The silence after felt like someone holding their breath. Saturday envelopes multiplied 12, small packets on the stoop like malignant snowflakes. Each contained a micro SD card. 12 cards, 12 future sessions. He lined them on his desk, heartbeat quickening. Tech-savvy cousin Will agreed to examine them. Metadata revealed a creation date, April 19, 2033, 10 years ahead. Another anomaly. File author M. Weiss, MD. Weiss felt the room tilt. Will dismissed the date as spoofable but ran checksums. Then he headed for coffee, leaving the laptop. Weiss opened the second card. Before the session audio, a weary preface spoke. "You asked for explanation? I'm complying. These aren't warnings, they're souvenirs. I tried to change outcomes too. I failed." The voice was unmistakably his, tempered by a decade of regret. He listened while daylight drained. Future self described the catalyst. 9 years hence, a patient's violent suicide during session. Trauma drove him to record debriefings. The files began timestamping backward, arriving earlier and earlier, as though grief sought prenatal refuge. The story slotted into private terrors he'd never voiced, his habit of scanning rooms for sharp objects, the dread that one slip would cost a life. Another realization bristled. The recordings never predicted events beyond the consulting room. No politics, no weather, just therapy failures, embodied imposter syndrome invading chronology. Perhaps they weren't physical artifacts, but florid delusion encoded as sound. If so, acknowledging psychosis could save or doom his career. Monday's evaluation loomed like a thunderhead. The evaluator, Dr. Anita Robb, ushered him into a minimalist cube scented with eucalyptus. He expected the session to mimic the script he'd heard, his defensive jousting, her polite skepticism. Instead, he spoke first. "Before we begin, I need to surrender something." He stacked the microSD cards on her desk. They may be meaningless or the key to everything. He recounted every detail, omitting nothing. Robb listened, face serene. She inserted a card into her laptop. It showed 0 bytes, another card, empty. "They're blank, Dr. Weiss." The floor seemed to yaw. Either reality was correcting itself or his mind was ripping seams. Tears blurred Robb's silhouette. He laughed, a brittle chime. "They're not blank," he whispered. "They're just early." Robb reached for the phone, perhaps to summon assistance. Behind Weiss, her smart speaker chimed and began playing audio. His voice filled the cube. "Monday, evaluation day. You will consider him psychotic." Weiss closed his eyes. The future had infiltrated a new channel. When he opened them, Robb sat frozen, torn between duty and wonder. Outside the window, a siren wailed, Dopplering away. The narrative, he understood, would keep rewriting him until he learned its grammar, whether prophecy, pathology, or something nameless that braided the two. He inhaled, steadying his voice. "Dr. Robb, let the recording play. Let's fail together, but consciously this time." She hesitated, then allowed the voice to flow, uncertain which of them was healer and which was patient, or whether time itself might need therapy before the hour was through.